have been stories and legends about birth taking place in water for a long, long time, from South Pacific islanders giving birth in shallow seawater to Egyptian pharaohs born in water. The first documented water birth that we know about took place in France in 1805. This mother had been having a long and difficult labour, so after a period of time was helped into a warm bath to relax. Soon after immersing herself in the warm bath, her labour progressed and she gave birth to her baby in the water. The soothing comfort of warm water is sought by so many of us at the end of a hard day. Or maybe not even a particularly hard day. We just require the comfort of warm water, the feeling of immersion and the sense of safety and privacy that it offers us. If you watch a labouring woman getting into a birth pool, you can clearly see why water births are so popular. The whole body, from the head down, softens, relaxes, and releases. Although birthing in water may not be considered pain relief as such, women talk about a sense of comfort and relaxation that comes from being in warm water. In fact, the National Institute for Health and Care Excellence, NICE, states that we should offer the woman the opportunity to labour in water for pain relief. Because birthing in water allows a woman to move freely and comfortably. It softens and protects the perineum and makes the woman feel held. As Millie Hill from the Positive Birth book states, perhaps water birth is also less painful because you feel more protected by the big dark skirts of the birth pool. You have more privacy and you are harder to reach. If anyone wants to touch you or examine you, they have to ask very nicely or get wet, or possibly both. The woman can float or sink down. Protected by the waters around her, she can be left in peace to labour. She can feel safe. Should she wish, she can invite her partner into the water to join her. It is her choice to share the space or not. Being born in water is safe for your baby. Many clients ask me if the baby will try to breathe in the water when born. The answer is no. Their throat will stay closed until they are brought up out of the water. They're still getting their oxygen supply via the placenta. For them, there has been very little change from the warm waters of your amniotic fluid. A Swedish study in 2017 found that women giving birth in water had a lower risk of second-degree perineal tears, shorter labours, and significantly less interventions. In another water birth study in Portugal in 2018, it was noted that being in water also reduced the length of time that the women were in labour, and that the early tests on babies, known as AGPAR scores, were excellent. If you need or would like monitoring of your baby's heart rate while you labour in water, this can be done using a waterproof handheld Doppler. If you're birthing at home, then you hire the pool with the knowledge that Mrs. Smith at number 34 will not be diving in there before you. It will be yours to use when and if you please. If you are birthing in a hospital in the midwife-led unit, then you need to find out in advance how many pools your hospital has. How many water births take place there each year? Are they usually fully in use, or is there regular space? Are the midwives all experienced with women giving birth in the birth pool? Or might they ask you to get out prior to the birth itself? As usual, all of the options are there for your choosing. You just need to find out all of the information before the birthday itself. Perhaps a water birth may be the best birth for you. It's definitely worth exploring.